Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, welcome back to Insurance Matchmaking. I don't know if you can tell, my voice probably still sounds a little weak. If you listened last week, I did a replay of a show with Steve Moore, a stroke survivor we did back in, I think it was back in May, and I was coughing, had really almost pretty much lost my voice, and I'm like, there's no way I can talk for a 30-minute radio show, so let's find a replay. It was the holiday weekend, and so kind of a rush job to get the recording done, and so we played that replay. But I've got Elijah with me today. We kind of want to recap the enrollment season. We're not completely out of the woods yet. We still have some time left on the under 65 healthcare marketplace enrollment, and it is also, we can't advertise it, but I think since I'm talking about enrollment periods, I'm legal to say it, there is what's called the Medicare Advantage open enrollment period, and that's if maybe you didn't change your plan or you meant to, or you found out your doctor's not in network, so you don't need a special enrollment, which is usually the only way you can change your Medicare Advantage plan before the next year, is we do have this enrollment period to the end of March. So you could, if you change your plan, we can only do it one time, and it will be for the first day of the month of the following month. So if we go to the end of March, it would be April 1st. So we've got the whole first quarter that we can switch your Medicare Advantage plan if that's needed, without any other special enrollment permissions. So if you think you're in the wrong plan, give us a call. Sometimes we can change it, sometimes we can't. We just, we can say, well, we're just going to look at that next fall. But, don't, the old saying is, they can't say no if you don't ask. So check with this. Don't just assume you can't change if you feel like you should change. We can help you with that. So Elijah, this was your first open enrollment. So
yeah.
So I kind of, as I mentioned to you the other day when I said when we come in, I wanted to kind of get your reflection on how the enrollment period went. What were some of your preconceived notions that you found out weren't exactly true, or things also, there's a lot of reflection too. Well, what should you have done better? What went great? What I need to make sure I never do that again. There's all those little things you can add, but I don't mean to keep rambling, and I need to try to save my voice. So it sounds like you're coughing too, so we may be trading off each other. But just kind of share some of your reflections of what transpired in your eyes of the open enrollment.
Okay, well, let's start in order. Preconceived notions. For one, this was my first open enrollment period, and actually found out that I absolutely love this job, being able to help people and navigate all there is to about Medicare, because it's not simple. And the booklet that you get each year, it's a lot of information, and being able to help people navigate that truly made me feel needed in society. And so I got to say, I love the business that we're in, Matt. Preconceived notions. I figured that most of the people who've been in Medicare for a while, or who've been on Medicare for a while, would have a good idea of what they're doing,
how their plan works.
Yeah. And that is completely not true.
Right.
And so one of the things that I noticed...
And that's why I'm not worried about AI taking my job.
Yeah. But one of the things I noticed is that you're never too young to start learning about Medicare. The amount of parents that brought their kids in to help them navigate this actually blew my mind. I didn't realize how many people were helping their parents find the insurance they needed.
Right.
And so if you're listening to this, don't think you have to be 65 to listen in and to understand Medicare, because you may have parents that are entering Medicare age or have been in Medicare, and so it's not too early to start educating yourself.
I want to take off on that. I haven't set the schedule yet. We do need to start our Welcome to Medicare seminars. I'm looking at probably maybe the last week of January or maybe in the first or second week of February, because we do need to do some I could do a presentation tomorrow, but I don't need to talk to an empty room. So I've got to kind of get some things together. Maybe do some Facebook advertising, send out, postcards of people that are turning 65. But like Elijah was saying, maybe you're not 65, or maybe you're not looking at Medicare yet, but your parents are on Medicare and you'd like to learn a little bit more how it works. You are more than welcome to come to one of those seminars, like I said, because we'll have some stuff on Facebook. One of the downsides this year is right now, at least the first part of the year, we're not going to be able to use the Cookeville Library. They've got a construction project going on, so they're not booking the rooms for any outside groups right now. But I'd always done, the previous year, when I would do an evening workshop somewhere, whether it was in Cookeville or Crossville at the Cumberland Business Incubator, is do a session at 2 o'clock at our office. This year, at least at the beginning of the year, it looks like I'm going to have to definitely schedule some of those evening sessions at our office, just to kind of get things going. But like I said, I got to try to get the things together for the advertising portion of that. So that's not quite there, but there'll be things on Facebook, there'll be things on our web page once we have those scheduled, and you're listening to, as Elijah said, maybe you're thinking about you need to learn a little bit more so you can help your parents with their Medicare. You're welcome to come to one of those sessions. You'll learn a lot, and you might find there's something that we can help you with too. We don't just do Medicare, we don't just do the under 65 health insurance. We do health, we do life, we help with dental plans, all those other different kinds of plans that everybody might need some help with. Long-term care is a big one. And when you're in your 60s getting ready to go on Medicare, that's not the time to talk to us about long-term care. When you're in your late 30s, even can do it early, but when you're in your 30s or 40s, that's really when you should be looking at what you're going to do about long-term care. And what was it you said you did a little research just on that, Elijah?
Yeah, it was funny. My mom had sent me a text, actually, and this is what got me started on talking to Matt about long-term care for my parents. She had sent me a text saying that she finds herself getting on her kids' nerves and pretty much a fast slope to the nursing home. And so I just Googled it. And did you know, Matt, that the average cost of a nursing home is around $9,000 to $10,000 a month?
Yeah, and catch that was month, folks, not year.
Yeah,
so when you're looking at, people are complaining about they might have to spend $1,500 or $2,000 a month for their families or they and their spouse's health insurance. Long-term care is, 8 to 10 times that. Yeah,
and it's not getting any cheaper.
Right. No, it's not.
And so one of the things I noticed was some of our carriers actually had policies that have inflation built into what they offer. So, yeah, the earlier you get on that, the more affordable that it becomes.
One of the things I thought of before I turned the mic over to you was this was my 11th enrollment season since I started into the health insurance business. And so I was in my 50s when I started, but I would talk to people about their Medicare, and they would say, well, is this the plan you'd put your mother on? And Elijah's worked with both of his parents, so he's taking the same approach with his potential clients, or what he's figuring out is going to help his parents or help his family.
Absolutely, yeah. And I think that's one of the reasons why I love what I do is I don't just rush through any appointment. I really take the time, and I think we all at Matt Libby Insurance do the same. We really take the time, take a consultative approach, find out what your needs are, and then we match what we can to fit those needs.
Right. I mean, it was like I said, I ended up running 3 appointments yesterday. I did one after you left because one was a lady in Kentucky that I had helped on a plan. And we ended up, as I said, the open enrollment period. I had just enrolled her because she just moved to Kentucky from Arizona. But she was able to meet with the doctor yesterday, and after talking to the doctor, there's what we call a chronic special needs plan. She has some heart issues, and she qualifies for one of those plans. So we decided that, because her doctor is in network with that plan, she was actually going to agree to see her out of network on the other plan. But it just kind of worked out, so we did that one. But I had an appointment. One of my clients, who was a client from one of the workshops, brought a friend of his in to, she was looking for something for her mother. And can I give you an idea? And not only for her mother, but she is also on Medicare. So it kind of gives you an idea why she's taking care of her mother. Her mother is actually 99. But after looking at what she has, I told her, I said, we might want to look at changing her drug plan when she next fall. But yes, her Medicare supplement is very expensive now because she's 99. But I don't know that taking her off of a Medicare supplement to put her on a Medicare Advantage would be a great idea. It could be. It would save a lot of money up front, but it does change some of your status. If you do need to be in a nursing home, they don't want you on an Advantage plan. That's a little frictionary between me and the assisted livings in nursing homes. But that was that one. And then I also had a couple come in that it basically really just kind of needed to get some paperwork. I'd already taken care of one plan for the wife because she's turning 65 in February, but the husband is going to be leaving his group plan, but he needed to get with Medicare to get his Part B started, and paperwork that I gave him to take to his employer to turn into so we could do that, they'd misplaced it. So we're kind of starting over. But we still have time. I mean, it'll still be in place for February 1st, but cards and things that will be on hand. And also, and I guess I better not mention carrier, but we do have one carrier. I've gotten a lot of calls this year that they haven't received their cards yet. And just know if they started mailing them out. Elijah had to actually call the broker support yesterday, and they said that they started mailing them out between the 14th and the 19th. So usually those things take a week to 10 days before they show up. So that's why they didn't show up before Christmas. Usually people get them around Christmas. I've really kind of been surprised how many people have called this year and hadn't received them yet. So hopefully, the time you're listening to this is Saturday. We're now a full week into the year. Hopefully, everybody's got their cards. If they don't have their cards, but actually, one of the people that was asking hadn't received the welcome letter either that had her ID number, which that was mailed out back in November, and she didn't receive it. So I said, well, it might be a mail issue versus being a carrier issue of not sending it out. So we covered the preconceived notions. What did you learn? What's something you learned during OEP? AEP.
A lot. One of the biggest things was, everybody calls it the alphabet soup of Medicare. Mm-hmm. But what I learned was there's a reason that it's set up like that, because no two people have the exact same health conditions. No two people have the exact same life situation, their income levels, everything's mm-hmm. different. And so learning why things were set up the way they were helps you determine what plan's going to work for which person. And so just really digging in and learning the ins and outs of it was what helped me become very efficient with dealing with people in their situations. And so, some people we worked through things together. Some appointments took 2 hours because their situation was unique and it was something I hadn't learned, and so I had to call you in. And luckily, being a local agent, we're not just somebody that you're talking to over the phone. We have Matt here who has 10 plus years experience, and so having him right there and being able to talk to him through certain situations was a huge help. And so that one of the things I learned was there's a lot of misinformation going out from call centers. My dad, to this day, is still getting calls every day from different carriers or different call centers trying to get him to switch what he has. And not going to say all agents are perfect, but if you found a good local agent, stick with them because they know your situation.
All right, we're up on the break here, and we'll be right back.
Dreams made real. It's more than a slogan, it's a mission. Join Upper Cumberland Habitat for Humanity for the first ever White County Dream Builders Luncheon on February the 10th from 12 to 1 p.m. at Life Church in Sparta. Be part of a powerful hour that supports affordable housing right here in the Upper Cumberland. General admission is just $20, or elevate your impact as a $250 table host. Scan the QR code on our social pages to purchase tickets. The White County Dream Builders Luncheon, February the 10th at Life Church in Sparta.
It's a new year, and it's time to drop old habits like slow internet and bad cell service. Make 2026 a year for better connections with Tri-Lite. Get gig speed connectivity at home and crystal clear wireless wherever you roam, all backed by the friendly and local Tri-Lite team. Bundle to save and start the new year right with Tri-Lite. Better internet, better wireless, better year. To learn more, call 833-847-0824 or visit trilite.net.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we're back on Insurance Matchmaking. I'm joined today with Elijah Ridley from my office. We've been reflecting on the AEP and OEP. AEP is the annual election period for Medicare. OEP in the fall is the under 65 health care marketplace, Affordable Care Act enrollment, also known as Obamacare. I know some people take offense to that term, but most people, when you say that, they know exactly what you're talking about. One of the things before I turn back to Elijah, I just kind of want to address again, and I think I addressed it last week, and I don't want to spend a lot of time on it, but I'm really getting frustrated with all the negative press that's like so anti, the Republicans took away your subsidies, or the one big beautiful bill took away your subsidies. And both of those things are actually completely false. Now, I'm not saying the Republicans are blameless, but they didn't take away the subsidies. The enhanced subsidies that were a COVID measure were first introduced in the American Rescue Plan, and they were set to expire like in 2023, I think it was, 22 or 23. It was only supposed to be like for a year or maybe 2 years. And then they passed the Inflation Reduction Act, which extended those subsidies until December of 2025, which was last month. That was all done during the Biden administration. Biden administration, the Democrats set the expiration date on the enhanced subsidies. The one big beautiful bill, what it did in regard to those subsidies was it didn't extend them. So you can say that that bill took it away, but it required legislation to extend them. That didn't happen. The other was they may have done some type of extension on them if we hadn't had the government shutdown, because the Democrats were saying, we're not going to open the government until you extend these. And a bunch of other things they were adding, and I'm not going to get into all that. But there was, 40 days or whatever we were shut down. There's 40 days that they could have debated and put some type of extension in. The other thing is we got all these people, and I've got an argument on Facebook with a friend of my cousin the other day, that the subsidies were gone. The subsidies are not gone. Because I said the subsidies aren't gone. They went back to the pre-2021 or pre-COVID formula. That's exactly what of the Affordable Care Act, whereas the cap on the income is 100% to 400% of the poverty level. And that's who it's hitting the hardest. It's not hitting the low income. The low income are still getting what they were getting. The silver plans are costing them more. A lot of the people with lower income had the silver with lower deductibles, get the cost sharing reduction. A lot of them, their plans went up generally $100 to $150 if they were getting the cost sharing subsidy. If they were above that 250%, in the silvers were fairly affordable last year. The rate increase of the policies from the carriers is what is actually causing their cost to be more than the expanded subsidies being extended. Those that are above the 400%, yes, their rates went way up because they were maybe getting $1,400 to $2,200 a month for a subsidy for a couple. And so they were paying me $400 or $500 a month for a silver plan last year. And now they're not getting subsidies. So I've moved a lot of folks to a bronze plan, and they're paying about $1,200 because they're not getting any subsidies. So we've had some elect that, and we've had some elect to go with the short-term plans or a fixed benefit plan if they're healthy enough to get those plans. That's the downside there is, if you have pre-existing conditions, you're kind of relegated to going on the marketplace. And I've had a couple couples that they've kind of had to split their insurance. One spouse has to go on the marketplace because of their health. But we're able to get an alternate plan for less than half of the cost of if they went on the marketplace. So there are opportunities out there. Wanted to let you know that. I know Elijah's done that with a few couples. He's waiting to hear back from a family that's probably going to go that route because they're not eligible for subsidy because of their income. So,
and speaking of, learning experiences, luckily I haven't wrote a policy like this, but you had brought it to my attention with these short-term plans. They're 364 days is what they cover. And there are plans that make the premium a whole lot less because they're 2 times 180 days. And when you do it like that, I did not realize until you brought it to my attention that, that deductible resets at that 180-day mark. And so you would have to meet the deductible twice. So thanks to you, I wasn't given enough time to make that mistake, and I thank you for that. And you had mentioned earlier that one of my parents is on Medicare, one is on the marketplace, and I take the approach of what would I do for my parents. Mm-hmm. And so one of the things is there are a lot of affordable short-term policies out there, but you got to think, what's the coverage limit? Mm-hmm. What are the terms? How long does it last? Does it cover the full year? Does your deductible reset midway through? And so those are things that, people don't think about. They're just looking for the lowest premium. And sometimes lowest premium isn't always best.
Right. Yeah, that is especially true for those on the Part D drug plans. Of course, we're not going to change anything there now unless you're coming new to Medicare. And I say new to Medicare, it's not just new to Medicare, but there's a lot of people, as you watch the news, we got a lot of people moving here. Everybody moving here, you got to change your health plan. If you're not moving here and picking up an employer plan, you're going to need to get another health plan. Now, if you have a Medicare supplement plan, what we call the Medigaps, a Plan G, a Plan F, a Plan N, you do not have to change those when you move. Generally, it's just a matter of updating your address with the carrier. We have care, even if that plan isn't available to purchase here in Tennessee, usually they will still cover you. If for some reason they can't, because they just can't cover anybody in a certain state, well, you've got a reason to get a new plan. If you have a Medicare Advantage plan or you have a Part D prescription drug plan, you have to change that when you move states. Now, I will say this, if you're on the plan that I don't like, that was 0 premium last year for a drug plan, and that drug plan works out okay for you, you do have to re-enroll, but you can call your customer service and they'll put you in one of their internal agents and go ahead and they'll switch that. So if you're fine with that, but maybe you've got, you had that low-cost plan and all your drugs were basically free or $1 or $2. And then now you've developed diabetes and your doctor's put you on one of those GLP-1 drugs or something like that, or maybe you've had a heart incident and now you're taking Eliquis as a blood thinner. Those are very expensive drugs. That drug plan may not be the right plan for you. You may want to come see us as Elijah said, just because the plan's the lowest price doesn't necessarily mean it's the best fit for you. I was looking at for somebody yesterday, just one drug. It made a difference between there was like a $50 plan and a $70 plan, the $77 plan and the $119 plan. The $119 plan was going to cost less over the year because of the way it handled the drug costs and didn't have the drug deductible. You'd kind of prepay it in the premium. So sometimes paying the higher premium can actually save you money. I mean, you're going to still pay a lot of money, but it's going to save you versus taking the one with the lower premium.
And speaking of, learning how formularies work for different companies and different pharmacies, take a look at the same medication. Mm-hmm. One company might have it listed as a tier 3 and another might have it listed as a tier 2. Yeah. And so tier 2s on certain plans don't need a deductible.
Right. They're not subject to the deductible.
So depending on what plan you get determines what tier that drug is on their formulary. Yeah. So it's a lot to go through. And I can't imagine people trying to figure this out on their own.
Right. Yeah, and that's been my specialty since I started doing this. And as like Elijah said, sometimes that appointment will take 2 hours. We try to book appointments for like an hour, especially during a busy time, to try to get done and then pick up that next person so we can see as many people during the day. And that's why we'll ask if you're coming in as a couple and you're both, especially with Medicare, you're both getting care, or you don't have to necessarily both be Medicare, but if one of you is Medicare, at least one of you are Medicare, but you both need insurance, those are two different appointments. So we really do need to schedule back-to-back appointments, because it takes about an hour to go over everything and, going through, shopping the drug plans, figuring out the doctors, comparing plans, and then actually doing the actual enrollment. And then we got to repeat that with the spouse. So yes, it does take a little time, especially when, we're working with a couple of, and generally it's, sometimes it's very quick. We'll have people who come in and like, oh no, I want the same exact thing my wife has. And we still will do the due diligence and make sure it still works doctors and drug wise, because just because it's a great plan for your spouse doesn't mean it's the right plan for you. Yeah. You've probably heard me, if you've been listening to the show for a while, I have couples that one's on a Medigap and a drug plan and the other one's on an Advantage plan, or I've got this one's on this Advantage and this one's on this Advantage. Because most of the time, a lot of times you do. If you just have a general practitioner, yeah, you might have the same doctor. But if you see any specialist, or sometimes, the wife wants a female doctor and the husband doesn't care, or the husband has a male doctor, so you don't necessarily have the same doctor. They may not be in the same practice. And as Elijah mentioned earlier, the networks. If your what's the best plan out there? The best plan out there is the one that covers your drugs at the lowest cost and your doctor's in network. That's the best plan. The worst plan is the one your doctor's not in network or it doesn't cover your drugs. So that's how we rank them. Now, of course, we'll rank two. Sometimes I don't want to work with this company. So, there's the one company, I'm not appointed with them anymore, because I didn't like their Medicare Advantage plans to begin with. But they really messed us over on the Part D prescription plans, so I'm just not, I do not recommend them. And I've always told people, when I did the drug plan, I was like, hey, this drug plan's cheap. It's going to be your cheapest plan out there for your drugs. They have terrible customer service, but this is the one that's going to save you the most money. And most people think, I'm getting prescriptions. I'm not going to be talking to customer service generally, so that's that. And I still recommend that plan to people and help them figure out how to enroll on that through Medicare.gov or something, because I can't enroll them in fact, basically, I've only got one carrier now that can actually enroll anybody in their plans. All the other carriers, they're not letting agents enroll in their plans. Or I guess they'll let us if we print out a paper app and send it in. And it's like, if I have to fill out a paper app, you don't get it. And you're not paying me for it anyway. I'm not taking the time to do a paper app. I'll show them how to do it on Medicare.gov or tell them to call the customer service or whatever. We are getting close to the end here. Elijah, you got any last-minute thing you want to say?
Yeah. One of the things that I was talking about before we hit the break, I just wanted to double down on that. Finding a local agent is really important, someone you trust, somebody that knows your history, your family history, and can make better recommendations, because like we had been mentioning, the lowest premium isn't always the best, and sometimes it is, but our job as local agents is to find what suits you best. And so taking that consultative approach, meeting with us, that's one of the things that will help you save a lot of money during your retirement.
All right, well, we've got another insurance matchmaking in the books. Always remember, at Matt Libby Insurance, we can cover you head to toe. It doesn't have to cost you an arm and a leg. Keep listening to Grace 107.7 and join us next week on Insurance Matchmaking.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.